This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting remotely. When you think about prominent residents in the history of Hartford, Mark Twain or Harriet Beecher Stowe may come to mind. But the Hartford Public Library has launched a summer program to highlight Black, Latinx, and Indigenous people who are also part of the city's history. Later, we'll talk with Jasmine Augusto about the library's Hartford Changemakers program and its focus on public art to help change the narrative. Also, in just a few weeks, colleges will begin to welcome back students for the fall semester. We'll hear from a UConn professor and psychologist who studies public health and social media. Dr. Sherry Pagotto asked students their feelings on quarantines, contact tracing, and mask wearing. She'll tell us what she learned and how it could help campus leaders and students better communicate. First, we talk about the importance of continued testing in this pandemic. Connecticut's rate of COVID-19 transmission is low compared to other states, and that's the result of a number of factors, including social or physical distancing, wearing masks, and contact tracing. But what does testing in Connecticut look like right now? Joining us with more is Patrick Skahill, a reporter at Connecticut Public Radio who covers science and the environment. Patrick, welcome back to the show.
Hi, Lucy.
So we look at the data of residents who've died from COVID-19. A majority of them have been nursing home residents. I wanted to start to talk to you about the testing guidelines for this at-risk population. What does it look like right now within nursing homes in our state?
Yeah, so right now more than 60% of the state's COVID-19 fatalities were residents of nursing homes. The guidelines right now, back in early June, Governor Lamont had ordered basically weekly mandatory tests for nursing home residents and staff members. Those tests were slated to begin no later than the week starting June 14th, and were supposed to extend for the duration of the civil preparedness and public health emergency. But what happened a few days after that executive order went into effect was the governor issued another executive order saying if a facility is COVID-free for 2 weeks, they can stop testing. And then there was a caveat to that order as well, which was if a resident or a staff member tests positive, the cycle has to start over again. So it's been a bit of a confusing process throughout this whole experience.
Do we know why the administration changed the guidelines for testing nursing home residents and staff?
Well, the administration has said that the change is in line with federal guidance from the Centers for Disease Control and Prevention. And, one thing to remember, as with everything COVID related, is that the time scale is so dramatically different than anything else government has really dealt with before. Days can make a huge difference in how the science changes and how policy changes on this. So CDC guidance has been changing throughout the duration of this pandemic for testing. And the state says that when they updated the governor's executive order, they were just keeping step with that change in guidance.
When we think about when the governor first said that nursing home residents and staff should be tested weekly, that sounds like a lot of tests. I'm just wondering, how much is this costing? Has that been part of the shift as well, Patrick? What do we know?
So the short answer is it is costing a lot of money. The longer answer is, the state would say this was not a move that was driven by cost, but the costs are real to this. Tens of millions of dollars for really just weeks of testing. What we do know is that we have several, I've obtained several contracts from the state on this topic. And some of those contracts show that the state is spending nearly $20 million for less than 3 months of testing work. So there are costs here. Right now, the federal government is paying for this, but it's been unclear how long that is actually going to last.
And this was through the Coronavirus Relief Fund that a lot of states were getting money from the federal government to help with the new costs of dealing with this pandemic, Patrick?
Right, yes. So this was money that was authorized through the Coronavirus Relief Fund, which was put into place through the CARES Act.
Before we talk more about who is processing these tests and the costs, we began the segment talking about, I think it's more than 60% of deaths here in Connecticut were from nursing home residents. Now that we know that cases are low in our state compared to April and compared to other states, what can you tell us about what it's looking like in nursing homes today in our state?
A lot better in terms of the amount of positive results that are coming back, and in terms of the amount of fatalities that have been happening there. It's certainly a lot better. However, the argument that's been made by workers' unions, for example, in response to the Lamont administration changing the testing guidelines for staff, is that, well, it's better now, but it might not stay that way, and we need to remain vigilant. We need to ensure that we are testing staff members on a regular basis that are working there, because people could be asymptomatic and bring COVID back into a facility. And if we're not testing for that, how would we know until someone did test positive? So it's looking better currently, but people are still definitely urging caution on this issue.
Meanwhile, you've been reporting on some investigations from the federal level of Connecticut nursing homes where there have been deaths of at least 3 elder care workers. What can you tell us about those investigations?
So they're ongoing right now. These are investigations done through the Occupational Safe and Health Administration, or OSHA. Like you said, there are 3 facilities that are currently being investigated. And there's also investigations going on at a psychiatric hospital here in Connecticut, Natchog Hospital, an investigation going on at Lawrence and Memorial Hospital. I would expect that more of these probably will come. But there isn't a ton of detail that I can provide on each of these investigations, just because they're still open cases.
And is the state tracking how many nursing home or elder care workers have died from COVID-19, Patrick?
The state is tracking it. They're now saying that at least 4 workers at nursing homes have died due to complications related to COVID. Numbers on this are still pretty tricky. I would urge caution with any of these numbers. Workers' unions have told me numbers that are higher, and state reports are also not accounting for numbers that we've confirmed through our own reporting at other assisted living facilities. So I would say at least 4, probably more at this point, but it's a tough thing to actually pin down exactly, because again, everything is just moving so fast on this topic.
You're hearing Patrick Skahill here on Where We Live. He's science and environment reporter for Connecticut Public Radio. We wanted to learn more about his reporting on testing, COVID-19 testing in our state. You mentioned the high costs, Patrick, in just 3 months of this pandemic that the federal government is helping the state of Connecticut pay. But in terms of vendors that the state is contracted to, you found some interesting information about how, again, the state has allowed these vendors to redact pricing information for testing. Why is that?
So the state has contracted with at least 7 vendors for COVID-19 testing. We requested the contracts. When we got them, they were very, very long, very, very expansive, extremely comprehensive. However, the one main thing that was redacted was the price that the state is paying for each test. What we do know is the average price that the state is paying for a COVID-19 test across all of those contracts. That's about $117. But the state has refused to release the exact pricing information. The state is saying that they're doing this essentially in the interest of taxpayers, saying that if we were to post publicly what we're paying each vendor at a negotiated rate to run a COVID-19 test, if that information is public, anyone who tries to price into this with a new contract is going to basically say, well, give me what you paid, give me the most that you're going to pay. And I know the most that you're going to pay because I can see everything that you paid, right? And that's something called shadow pricing. So the comptroller's office has said that we don't want to release that to guard against that. Our argument as reporters has been, well, it's taxpayer money paying for this. It's in a public contract. It should be public knowledge.
It is interesting when we talk about the time frame in your stories in terms of the state communicating with these vendors about redacting certain information, these contracts. You did a story in early July where it appeared the state was really bending over backwards to allow Quest to redact cost information after it missed the deadline. Why that approach, Patrick?
I would dare not try to answer the question why. I can tell you what we know, which is that there was a contractual deadline for Quest to post their redactions. They missed it. The state sent several follow-up emails soliciting those redactions. And eventually, when I got the contract, the price was redacted. Why they did it, you'd have to ask them, I suppose. I can say we have filed a complaint with the Freedom of Information Commission to fight these redactions, though, because again, our argument has been that these are public contracts and this is public information.
That is an important point to stress. When we think about, in your reporting, when we think about how Connecticut pays vendors and other situations, again, what have you found in terms of how these contracts disclose the costs for these different services? Has the approach been different, Patrick?
So the approach has been different in other purchase orders that I've gotten from the state, particularly with regards to personal protective equipment or PPE. I've obtained dozens of purchase orders. I think all of them that I have do have the per unit price for something like face masks or hospital gowns. That hasn't been redacted. Whether or not this is common practice throughout all of state contracts, I don't know. Again, we're focusing on this one thing. But I have gotten per unit pricing information in other documents that I've obtained from the state during this pandemic.
We're hearing that wait times to receive COVID-19 test results are now stretching longer than just a couple of days as we see cases surging around our country and other states. Do we know how that's impacting wait times for vendors in the state to process these tests in Connecticut, Patrick?
Well, in some of the newer contracts that I've received from some of the care partners that the state is working with to do testing for staff and residents at nursing homes, there's actually language in those contracts that will say something to the effect of, due to stresses on the national testing system, you may expect delays in getting test results. And there are clauses in at least one of those contracts that says, normally, we would want to turn these test results around in 24 hours. However, due to these nationwide delays, it might be 72 hours. So we are starting to see some of what's happening nationally get reflected in contracting language that we're seeing here in the state.
Patrick Skahill, again, is a reporter for WNPR Connecticut Public Radio. He covers science and the environment. We'll tweet out some links to your stories about testing here in our state. Patrick, thanks for joining us today.
Thanks, Lucy.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, there have been a lot of new guidelines that colleges and universities have developed for returning college students this fall. How do students feel about the measures needed to keep campuses safe? We're going to hear from a psychologist and UConn professor who studies public health and social media about what she learned after interviewing students. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. In just a few weeks, colleges will begin to welcome back students for the fall semester. How do students feel about the new guidelines on campus? Dr. Cherry Pagotto is a UConn professor and clinical psychologist who studies public health and social media. She asked students their feelings on quarantines, contact tracing, and mask wearing. She joins us now to tell us what she learned from those interviews and focus groups. Dr. Cherry Pagotto, welcome to the show.
Thanks for having me.
And again, you're a UConn professor in the Department of Allied Health Sciences and clinical psychologist. I wanted to clarify the work that you were doing necessarily wasn't on behalf of UConn administrators, but tell us more about how these working groups were convened and how you reached out to students.
Yeah, so we convened a behavioral science working group within our research institute called InChip at UConn. And our group is basically a collection of behavioral scientists, and we were tasked with thinking about this from a behavioral science lens. And so, what I mean by that is a lot of the safety measures that are being considered require behavior, human behavior. And so we have to think about how would we get people to engage in all of these different safety measures. And so I had already been doing some focus groups as part of a National Science Foundation grant of undergraduates about how the shutdown affected them. And so it seemed a natural extension to shift a little bit and ask folks what they think about all of the plans that are coming down the pike for the fall and coming back on campus. And so we asked them about all of the different safety measures, including the pre-semester quarantine, which is where students would need to come back on campus 14 days early to quarantine. We asked them about contact tracing, symptom tracking, testing, wearing masks, and the whole nine yards to see what their thoughts were. We approached this very much from a co-design perspective. And what I mean by that is we first asked them what would make each of these things very difficult. So let's just kind of go down that road. What would make this hard? What could happen where it wouldn't work? And then we shift the conversation to, okay, how do we avoid those things from happening and come up with some solutions to those things? And so it was wonderful to have students brainstorming with us about that because they thought of so many things that I probably would not have thought of. I'm much older than they are. I'm not in their shoes right now. So I felt like this was a useful process to figure out how we could make this work.
Can you give me an idea of what some of the responses were? Again, this was an informal project, but when we think about pre-semester quarantine, what did students tell you about how they thought that was going to work?
Yes, it's a good question. So pre-semester quarantine was a tricky one. You know, they had a lot of concerns about it. When asked kind of what would make this difficult, they said, you know, it's hard to imagine sitting in my dorm by myself because they would be alone in a dorm for 2 weeks. School hasn't started yet, so it's not that I could occupy myself with homework. So what sort of activities would I have? This, you know, it might be very boring. And knowing that my friends who I have not seen since March are not very far away, there's the temptation to want to engage with them and hang out with them. And it might also be uncomfortable in the dorms. It could be hot. Not all dorms have air conditioning. So they felt like there could be a lot of temptations and they could imagine their peers breaking quarantine in order to socialize, or maybe even being tempted to drive back home for those who may not live that far. So they were very honest about how this could be hard. But in terms of solutions, they said, you know, if there were activities to keep us busy, that would really help. And if there were ways that we could socialize that were safe, that would really help. And we talked about ways to do that online. So all kinds of creative ideas about how people could socialize online, like having floor meetings online, having trivia nights, all kinds of ideas that were both fun or productive, like research experiences that could be online. In fact, my lab, we're gonna do a 2-week research boot camp. So that will keep students busy who are going to be on campus during that quarantine period. So they were kind of looking for, you know, how can I stay busy? And that made a lot of sense. They were also interested in finding out more ways to kind of use outside spaces. If they could be outside a little bit more in ways that are socially distanced, they were interested in that. And so I think kind of how it's created and what the parameters are will be very important, and communicating them all of those parameters to them as well, because one thing I noticed is they weren't quite sure, and I think a lot of people aren't, not just young people, what quarantine means. This is a new concept for all of us. And so what are the do's and don'ts of quarantine? I think just some really specifics about that could be very useful.
And when we think about the different populations on campus, Sherry, college is a social experience. And when we think about behaviors, it might be one thing to say, you need to do this for a certain amount of time, but knowing how young people are, it might be difficult to keep that kind of behavior going as the semester continues.
Absolutely. And students pointed that out. And I thought that was really wise of them to point out this sort of trend of behavioral fatigue. So whenever we're taking on new behaviors over time, we wear out. And I think we saw that with all of us when we shut down, we were starting to wear out. And people were in a hurry to reopen. So we have to sort of anticipate that anything that is put in place at any university, that, after a few weeks or a month or two, we may see a fatigue happening, in which case we kind of need to refresh things in some way, whether that is new messaging, more opportunities for conversation around how to make this work, new activities to make it fun. But I think whatever we're doing to put it in place, we have to make sure that doesn't fatigue, because we'll need to keep boosting it as the semester goes on, so people are reminded and don't sort of fall off the wagon as time goes by.
You're hearing Dr. Sherry Pagato on Zoom talking with us here on Where We Live. She's a UConn professor in the Department of Allied Health Sciences, also a clinical psychologist, as we talk about some focus groups that she and her colleagues conducted of UConn students about how they're feeling with these new protocols in place for campus reopening in this pandemic. You can join our conversation. Find us on Facebook and Twitter at Where We Live. We talked about the quarantining, but I'm curious about how college students perceive, the ones you spoke to, perceive the necessity of wearing a mask, and also if someone falls ill, how they comply with contact tracing. Sherry.
Great question. So let's talk about mask wearing. I was encouraged that students seemed very open to wearing masks on campus. They didn't see too much of a problem wearing it in in-person type environments, courses, labs, and things like that. They were honest, though, that the challenge would lie when they're socializing on their own, whether it's on campus or off campus. And they pointed out that, that really tends to be driven by social norms. What they're observing over the summer is that mask wearing in their age group has been inconsistent in social situations. And so then the pressure is sort of on, if other people aren't wearing masks, then you might, I don't want to be the only one wearing a mask. They pointed out how masks can interfere with their ability to socialize. So for example, those with hearing impairments, they don't have the ability to read lips, or maybe you need to talk louder. It's hard to hear people. So those were the kinds of things that they talked about that I think we all experience. So again, a lot of what they said, I don't think is necessarily just particular to young adults, as I see adults of all ages, struggling with these things. And so in terms of solving that issue around mask wearing when young people are on their own time, I really think we have to think about how all of us can help encourage that social norm. Obviously, the universities can help with that, but also I think parents and young people attempting to hold each other accountable. And they talked about that. They said, this is something that we really need to do. We need to hold each other accountable. And I felt like they had a very mature perspective from that point of view. But honest at the same time around, it's hard when you're in a group of people who aren't doing it. And so it sort of can sometimes depend on your social status in that group. So I think helping students have those conversations of, what if I do show up to something and no one's wearing masks? What do I say? I don't want to come off like a jerk. So what's the language that I could use to get people to wear the mask, or at least to where I could put on my mask and not feel embarrassed. So how could they have those conversations? So those are some things I think we could help them with.
It's especially important to understand how young people feel about these guidelines, these protocols, Sherry, because, we're hearing, even here in Connecticut, that when you're looking at cases of COVID within age groups, cases are rising among 20 to 29-year-olds. The governor's office saying that this age group saw the highest number of new cases earlier this month. And so when we think about on-campus activities might be easier to enforce mask wearing versus off-campus, again, those strategies of how to deal with those different social situations are important, Sherry.
Absolutely. And we have lots of literature in other areas of health, for example, on condom use around how do you have conversations, asking your partner to engage in the safety behavior. So I think there are a lot of insights we can draw from other sort of similar type of behavioral scenarios. You also asked about contact tracing, and now there are lots of mobile apps that help with the contact tracing. And so we did talk a lot about contact tracing. And one thing that was interesting that came up was on a campus, it's smaller than a city. And so if you come up positive and then the contact trace and your contacts are contacted, obviously confidentially, your name is never mentioned when your contacts are contacted. But there is this fear that people would still find out that I was infected, and might I be shamed for that? Might people be upset with me? Will I get shamed on social media? Will rumors go around? So they were concerned about the social implications of that. It was interesting because they didn't feel like this is something that they would engage in. It was something more that they were worried about happening to them. And so I'm hoping that maybe that wouldn't happen. And, we could try to head that off at the pass by sort of destigmatizing infection in ways to sort of offset people from wanting to sort of hit each other over the head, if they get infected, or be very upset at you because now I'm quarantined because you got infected and I was near you. So I think we have to really try to be mindful that doesn't kind of spiral in a negative way, to where if it does feel like there's going to be a lot of shame around infection, whenever there's shame, it drives behavior underground. So we really have to think about how to sort of prevent that shame. Some ideas that came up were, maybe when a student gets infected, there might be one who wants to tell their story of what happened and the lessons learned, and to sort of come out and talk about it in a way that everyone can sort of learn from that. And I liked that idea. And I've seen some of that happening on social media, people all different ages, where they say, oh, I got infected, and, I'll be honest, I was around someone who only quarantined for 12 days, and, I thought 12 would be okay, but I was wrong. Lesson learned. And I hope you all can learn that lesson as well. So those sort of stories, I think, are impactful and might kind of reduce the shame factor, and also be an opportunity for people to learn how people are getting infected, and the importance of not cutting corners on those recommendations.
That's interesting. So when we think about compliance or getting people to follow through with contact tracing, this idea that you want to emphasize empathy rather than punishment, that might get people thinking more about how this is good for everyone and not just how this is going to impact me individually.
Absolutely. Yeah, there was a lot of talk to the effect of empathy, of really, I think young people do want to know that we understand their predicament. They've lost graduations. They're losing a significant chunk of their college experience. They're socially isolated. They're single for the most part, so they don't have, a partner that they're always with. They'll be leaving their families to, some of them to come back on campus. So the social support in their lives is, become very restricted. They're going through something very hard too. And they sometimes cave to temptations. And so I see on social media a lot of rhetoric that saying things like, oh, young people are so irresponsible. They just don't care about anything but themselves. And I feel like that's really unfair, and it's super unproductive. It's never useful to kind of go that route if you really want to help everyone sort of get on the same team. And quite honestly, adults of all ages have caved to temptations when it comes to breaking some of these rules. And so I think beating up on young adults is not going to do us any favors, and it's not going to help us figure out how we can all, bring our best game, to this situation for the time being.
You've gotten some good information from these focus groups with students. And so what are some steps that universities can take to consider the way students feel about, going back to school in a very different time, hoping to go back to normal at some point, maybe spring semester. But in the meantime, effective ways that the universities can communicate with students about these protocols and why they're important?
Yeah, I mean, I really like a lot of the things going on at UConn where students are really being engaged in the process in all different ways. I mentioned the focus groups that we did, but there were also surveys and town halls, and student leaders are being engaged. So any ways that students can be engaged in this process. I know at a lot of universities, like the information coming out is sort of trickling out because everything has been very fluid and ever changing, and lots of work this summer to get everything decided and worked out. So a strong communication strategy, I think, is important too. So everybody's on the same page. And I will say not just students, but also parents, bringing parents into the mix and listening and understanding how they feel and their ideas on how to implement some of these measures that we need students to participate in. So I really feel like it's kind of an all hands on deck where, engaging these different stakeholders will be very important.
I understand that your research looks at how to use technology to better public health. And so thinking about how the general public has used social media during the pandemic and what you have learned in your research, I mean, what are some areas that you want to focus on or think that people should examine as we continue in this pandemic, Sherry?
Yeah, so I've been very interested in the infodemic aspect of this pandemic, which refers to the misinformation or the confusing information environment online, and certainly social media contributes to that. Obviously, the science is evolving, and so sometimes what our scientists are saying is gradually changing as they're learning. That can be confusing to a lot of people, but then there's also a bunch of other voices in the mix that are saying things that are just simply not true. And so then it becomes very difficult for the general public to understand what is correct, what is incorrect. And for that reason, it becomes difficult to know what I should be doing as an individual because everything seems to be changing. So we are working on a number of projects looking at how we can deliver clear messaging, particularly around the vaccine. This is something that I've been very interested in, is vaccine misinformation, and how can we understand how hesitant people might be about this upcoming vaccine and what we can do from a messaging standpoint to help people feel comfortable about it. Obviously, they are working very hard and very quickly to have a vaccine come out. People may have more concerns maybe about this vaccine than other vaccines because of that. So how can we message around the vaccine to make it clear sort of what the process is, and that people feel comfortable with the science that's coming out, and that they understand the process, and that it is the usual process that we would take. It's just a lot of resources have been put towards it that's allowed it to go more quickly. So that's a big concern of mine that we'll see more about, I guess, in the next year or so as that vaccine comes out. Obviously, we want a high level of uptake of that vaccine in order to kind of get to the other side of this eventually.
Right now, people are anticipating, again, that colleges and universities in our state will be reopening, on campus will be reopening this fall. I'm just wondering, as we move forward, everyone wants to focus on the first couple of weeks and how it goes, but in terms of what the university's role is in helping continue to educate the students as a semester continues, as information about this pandemic changes, what should be their role, Sherry?
Yes, I think universities have a strong role in making sure that they are delivering the public health messages to the university community, the students, so that they are able to get that accurate messaging out there, knowing that, all around is social media, there's all kinds of confusing messaging, but if the university has a role and I see a lot of the university social media feeds putting out, good information about COVID and how to protect yourself from it and some of the latest science. So I think that's really, really useful, and it will be very, very important to sort of keep those messages there and have a lot of opportunity for students and other folks on campus to ask questions. I also think bringing faculty into this to where faculty have good information so that, because they're often the interface for students. I mean, they're the most common interface is you spend most time with your faculty. So faculty need to be educated and be able to answer questions since they are sort of the frontline communicators with students.
I just want to let our listeners know that we're working to have UConn administrators come on for an upcoming show to talk about how the campus is reopening. We have requests out for either UConn President Katsouleas or the new provost, and we hope to have an update for our listeners in just a couple of weeks. Dr. Sherry Pagotto, it's been really interesting speaking with you about these focus groups. Before we let you go, as a member of the faculty, how are you feeling personally about starting the campus, having it reopen and starting up this fall?
Well, obviously there's a little bit of nerves there. This is uncharted territory. Mm-hmm. No one knows what's going to happen. And so, we're opening cautiously. And so I can't say that I'm not nervous, a little bit nervous about it. And I just hope that, I'm encouraged that the numbers have been pretty good in Connecticut. And so the stage is probably one of the better stages around the country in order to even think about a reopening. But I don't think anybody isn't nervous a little bit, at the very least, to say the least. Dr.
Sherry Pagotto, again, is a UConn professor in the Department of Allied Health Sciences and also a clinical psychologist. Thanks so much for joining us today.
Thank you.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. After the break, we're going to shift our focus and find out how the Hartford Public Library is working to update the traditional historical narrative of the capital city. You can join us too. Find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. When you think about the history you were taught in school, how often did the lessons focus on the contributions of Black, Latinx, and Indigenous communities? Hartford resident Jasmine Augusto is working on a summer project at the Hartford Public Library to change the narrative residents and others most often hear when thinking of prominent figures in the city's history. It's called the Hartford Changemakers Summer Program, and we wanted to learn more. Jasmine joins us now by phone. She's also education and community outreach manager at the Hartford History Center at the Hartford Public Library. Jasmine, welcome to our show.
Hello, good morning.
So tell me, before we begin and learn about change makers, I wanted to learn a little bit about your passion for the history of the city that you grew up in. Tell me about when you really started to get interested in Hartford's history.
Sure. So just as you said, actually, I went to Conard High School in West Hartford, and I remember taking a U.S. history class my junior, senior year, and immediately being drawn to, I probably only really remember the few sections in the textbook about the civil rights movement. And it was just a few key figures that we always hear about, Martin Luther King Jr., Rosa Parks. And I was still hungry. I was still excited and hungry for more. And it wasn't really until I went to college, Trinity College, and took a class called Hartford on Film, my freshman year of college, that I got exposed to this amazing collection of 1969 footage from Hartford that delved into the housing issues, urban renewal, police community relations, education. And it was told by the perspective of Black and Puerto Rican residents in the city of Hartford at that time, 1969, kind of an explosive moment. It was like 3 summers of riots that happened. The city was really changing. A lot of, white folks were moving to the suburbs, and Hartford was really starting to become a majority Black and brown city. And there was something in that for me that was just like so exciting to see more of, I guess, my community members be part of what was happening in the city, what was challenging in the city, and also like how they were looking to claim space culturally and develop their own social services.
Mm-hmm. When we think about updating this traditional historical narrative that many people have of Hartford, how do you begin, Jasmine, and how do you get people engaged, especially during the summer in a pandemic?
This is a huge challenge. Gratefully, we've been, developing relationships. This summer program is a collaboration between a few different departments in the Hartford Public Library. So the Hartford History Center, and we have a lot of relationships with some of the elders in our city, especially because we've done some oral history projects and, continue to kind of develop those relationships and build intergenerational programming. So some of that was like phone calls to folks and text messages along with emails. The U Media Teen Center that really, focuses on teens in our city. Nigel White is a program coordinator there and has also a relationship with a lot of the teens and teen mentors. And then Liz Castle, who's heading up general programming at the Hartford Public Library, also has a relationship with a lot of elders and adults through the intergenerational programming that she runs. So kind of through our forces combined and our social media and our personal connections, we've been able to kind of engage a wide variety of folks in our city. It's still not enough. There still needs to be a lot more folks that get involved, but this is kind of what we're able to do right now with what we've got. We've also put up signs in the locations of where we are going to be developing murals to get to give folks a number and a website that they can go to if they want to learn more.
I love the public art aspect of this program. Before we get to that, I started the show mentioning when people think of prominent figures in Hartford, they think of Mark Twain and Harriet Beecher Stowe. Who are some of the people that you hope to highlight within this summer program?
Oh my goodness, we have over 40. We've developed a library guide or a subject guide that's online of a number of Hartford historical change makers. This, oh my goodness, there's so many. But I would love to just point out that so many of our folks have done multiple different types of contributions to the city. So they are artists, they are politicians, they have worked in developing housing, developing travel agencies. They were leaders of faith institutions. So there's so many different kinds of folks. So one I was going to point out is Bessie Prophet, who a lot of folks don't really know about. She was born in 1898. She passed in 1973. She was Hartford's first lady of jazz. She had more than a 50-year singing career that really started in the 1920s. And what I love about her is that she was not just this incredible singer and went in and out of both white and Black circles as a singer, but she also was passionate about all folks accessing the joy of music and hosted performances in Connecticut prisons with inmates. And not only, she was also a civic leader, and she was one of the founding members of the Citizens Committee of the North End and raised the initial $1,000 that went to the George A. Parker Memorial Center, which is today one of our, important rec centers in the North End of the city.
Mm-hmm. That's really interesting. I'd love to have you back and we can just go through all of the different people that you're highlighting, Jasmine. But let's talk about the public art aspect of this. Again, the Hartford Changemakers program within the summer, how you're getting teens and adults and muralists together and where they'll be unveiling these murals.
Sure. So the murals are definitely the central part or one of the an important aspect of the summer program. We're going to be having one at Melanin in the North End, right on Blue Hills and Albany Ave, which is right near our Albany Library. And then we have the second one on Park Street near our Park Library, both our old and our new one. And it's in a little like kind of lot of land and like wall buildings over there called the Art Box, which was a community project by folks in the neighborhood to kind of like create a little community oasis within Park Street, an outdoor location. And so the murals are actually, as we speak, being developed, designed by an intergenerational group, both from the north and south ends of the city. They're going to be looking at a number of the change makers and kind of deciding who they want to portray, who they're really interested in. Our LibGuide includes reference materials, includes footage of some folks. And then what's also exciting about this is that because it's an intergenerational group and there's elders that are part of this process, they'll also be helping us kind of to illuminate these stories a little bit more, not just kind of the articles that were written about these folks, but the, who they really were as mentors, as people to look up to. And so we're hoping that the murals will portray not just, portraits, but a way for folks to be able to understand how those folks contributed to the city visually. And we're hoping to also include, a little bit more information alongside the mural so that you could walk by, get more information, get a link to find even more information about folks. Those will be revealed at the end of the summer program. So we're looking at August 22nd and 29th, which are both Saturdays. And so there's definitely a virtual aspect of this, right? All of our workshops are virtually happening right now, but there is going to be a physical aspect in terms of painting. And so the muralists, the two head muralists, Linda Luz Carrillo and Mina Echevarria, who are both Hartford born and bred. Linda grew up in Hartford. They are going to be scheduling out, sections of time so that like small groups with masks can paint the mural step by step along the period of time. And then during the actual mural reveal will be a virtual program with both pre-recorded and like live aspects. So we are going to be having not only the mural reveal, but we will be having folks doing poetry, music, dance, storytelling, and also showcasing our documentary photographers, because there's also a documentary photography workshop. So really we're trying to show not only about these historical figures, but about how folks in the city are talking about their own stories, about sharing their own neighborhood stories. And we really are placing value on community knowledge and community storytelling.
Well, this sounds great, Jasmine. We know that art can connect people from all different backgrounds. And when we throw history into it, it's making it more accessible to more people. We can't wait to see what your workshop participants create, I think in September when you mentioned they'll be unveiled. Jasmine, we'd love to have you back. Jasmine Augusto, Education and Community Outreach Manager for the Hartford History Center at the Hartford Public Library. For our listeners who want to learn more about the Hartford Changemakers program, Jasmine, where can they go online?
So you can go to our website, hplct.org. You'll see like a banner on the front part of the page that will lead you to a link. You can also go to the Programs and Exhibits tab. And then you can also click on Hartford History Center and find our catalog, which has our subject guides that includes the Hartford Changemakers link to the LibGuide that I was talking about earlier.
And we'll be sure to link that to our website, WNPR.org/where we live. Jasmine, thanks for coming on today. We appreciate it.
Thanks so much.
Today's show produced by Tess Terrible. Our technical producer is Kat Pastor. Learn more about the show. Just download Where We Live on your favorite podcast app. I'm Lucy Nalpathanchel. Thanks for listening.